Hi doctors, now we are going to see about one of the important and basic repertory, that is Repertory of Homeopathic Medicine Medica by J.T. Kent. Here we are going to discuss a rubric hunting part. This is very important for practical purpose and for examination purpose also. Let's see. First we will see the practical guidelines for the particular symptom or particular rubric, where we can find it, in which chapter we can find it. For example, appetite, aversion, desire, erection, heartburn, and hiccough related rubric present in the stomach chapter. Then in external throat chapter, we can see the rubrics like goiter, swelling glands, for example, cervical, thyroid. Then important rubric, that is torticollis, present in the external throat chapter. Then in stool chapter, we can see the character of stool like acrid, bilious, black, bloody, then watery and yellow like that. Then in urine chapter, we can see the character of urine like acrid, bloody, cast, milky, scanty, etc. Then in mouth chapter, we can see the rubric related to tongue, palate, gums. These are presented inside the mouth. So we can see in the mouth chapter. Then apthe, then bleeding gums, then coated tongue, dryness of the tongue, cracked discoloration, salivation related rubrics and speech related rubrics, then face related rubrics present in the mouth chapter. Then in face chapter, we can see the rubric related to outside of the face, like lips, cracked lips, enlarged glands like parotid and submaxillary glands. Then lockjaw, this is important rubric, lockjaw. Then saving aggravation, this is also important rubric. This is one of the important single remedy rubric. The single remedy is carbonimalis for saving aggravation, which is present in the face chapter. Okay, then in throat chapter, we can see the rubric related to esophagus, pharynx, tonsil is very important rubric, then uvula, etc. Then in chest chapter, we can see the rubric related to lungs, heart, aorta, etc. Okay, like diaphragm, etc. Then in rectum chapter, we can see the rubric related to anus and perineum. Then in abdomen chapter, the regions of abdomen like hypochondriac, iliac region, and organs like liver, etc. Then generals we can see in mainly in mind chapter and generalities we all know. Then in sleep chapter, this is very important. Generals we can see in mind, generalities, and sleep chapters. Then finally, diagnostic rubrics mainly present in the generalities chapter and then related to particular parts. Okay. Then we are going to see the symptoms and rubrics. Okay. So here we included some important common symptoms. For that, we can see the chapters, the how rubric is present like that. First, we will see knee pain. Knee pain. Patient commonly complains about knee pain and unable to rise from seat. So how we can see this in extremities chapter? We can see pain rubric, then knee, then rising from seat. Okay, this arrangement of rubric also very important for selecting a particular rubric and for examination purpose also. Then cervical pain, cervical spondylosis, main symptom is cervical pain. So how we can see in back chapter, pain, cervical region, radiating pain, extending arm and fingers too. For radiating pain, we can see like this rubric. Then very important sciatica, how we can see in extremities chapter, how we can see pain, lower limbs, then sciatica. Okay, this is very important. This arrangement is very important. Then for ulcer, how we can see skin chapter ulcer, heartburn, how it is present in stomach chapter, heartburn. In erectations, how we can see stomach chapter erectations. Then we are coming to pneumonia. We all know in chest chapter it will be there. Then how it is present. Appetization of lungs, you can see like this. Then inflammation in lungs, pleura, pneumonia like that. Okay, then blood sepsis, how we can see genital chapter septicemia. Okay, then insect bite, how we can see in skin chapter stings of insects. Okay, here they the particular chapter here they give insects like that. So particularly they are mentioning the insect. So we have to go for particular rubric, particular chapter that is skin stings of insect. Then general rubric bites of poisonous animal where you can see so general it is wounds bites of poisonous animal. Okay, like this we have to see. Then very important one, what is diabetes mellitus. Diabetes, urine, sugar. Then hay fever, that is allergic rhinitis, how we can see in nose chapter, coryza annual. In bracket we can see the hay fever. Then very important, goiter, external throat, goiter. Lockjaw also very important. In face chapter, lockjaw. Then piles. Piles where we can see rectum, hemorrhoids. Then this is also very important. Apart from rectum chapter where we can find the hemorrhoids rubric, like that they can ask questions. So for that where we can see in urinary system, bladder subchapter we can see hemorrhoids of like that rubric. Okay, then the suppression of urine, it is present in the kidney chapter. Why where urine secretes were filtering in kidney chapter. So if any problem in kidney, there will be a problem in secretion. So simply we can think like that, we can answer easily. Okay, then retention of urine, here there is no problem in secretion and filtration. Okay, so where urine stores in bladder, so there is a problem in bladder. So we have to go for bladder chapter. You can see retention of urine. Okay, yawning also very important one. Sleep we can find a yawning rubric. Diarrhea, the character of diarrhea, the character of stool present in stool chapter, separate chapter, but general term diarrhea present in rectum chapter. This is important one. Then want to sit mentally, they want rest like that. So we have to go for mind, sit inclination to, like that we have to see. Then anemia, this is very important one, but easily you can find out. General chapter anemia. Then renal calculi, where we can found urine, sediment, renal calculi. Then bladder calculi also we can found. Snoring rubric, where we can find respiration, snoring. Then there are two important rubrics, like diarrhea, amelioration, constipation, relieved by constipation, like that. So relieved by constipation we can find in generalitis chapter. Amelioration by diarrhea we can find in rectum chapter. Okay, this is very important one. Okay, next we are going to see about cirrhosis of liver. So, symptoms related to liver present in abdomen chapter. As we saw earlier, we have to go for abdomen. Okay. Then typhoid fever chapter, continuous fever, typhus, typhoid, etc. Eats but emaciates, where we can found stomach chapter, appetite, ravenous, emaciation with. Actually, this rubric is practically it will be useful. Some patient is to complain, mm, my child is eating well but not getting weight, gaining weight, like that, na. So for that we can use this rubric. Okay, whenever we are having one question in examination or rubric hunting means, just we have to read that question first, we have to think chapter it can be there, like that. After that we have to see options, so we will have some idea. According to that we have to answer. Okay, then we are going to see some other rubrics like marasmus we all know, the diagnostic rubric. So where we can find in general test chapter how we can find emaciation children in bracket we can see the marasmus. Then jaundice, very very important one, where we can find skin discoloration, yellow jaundice. Then this would bibo, also very important one, where we can found in abdomen bibo. Then sometimes patient is to tell is to complain like dread of bathing. Usually children have this problem, so where we can find a general chapter bathing dread of. Then nervous nerves, where we can find mind chapter restlessness nervousness, like that. Then sudden nervousness present in generalitis chapter, how shuddering and nervous. Chorea from fright, generalitis. Chorea, fright from. Okay, this is also very important one. Sometimes if you think simply without guessing or much thinking means sometimes we used to answer mind chapter, but the thing is chorea from fright present in generalitis chapter. There are some exceptions. Okay, so we have to think very carefully. Okay. Then tumor in mammy, so commonly we to chest chapter we can find involuntary stool and urine both present in rectum chapter. This is very very important. Involuntary stool, urination and stool. Like that we can see the rubric arrangement. Then children puts fingers in the mouth, where we can see mouth chapter, fingers in the mouth, children's put, like that rubric arrangement. Then thirstlessness with a dry mouth, which chapter we can see in mouth chapter, dryness, thirstlessness, like that. Okay. Okay. Next, the dandruff present in head chapter. Then torticollis, as we saw earlier, very very important one, present in external throat chapter. Torticollis, external throat chapter. Okay. Okay. With this, we are concluding this video. In upcoming videos, we will see by part. First, we'll complete these rubric arrangement common for common symptoms and complaints. After that, finally, we will discuss about some important previous year questions, the question which are came previous year question paper examinations. Okay, thank you.